Jumbo Love, live on the Senior Scoop Internet Radio Show. And the beautiful queen that you see in the screen with me is Robin Shackelford. You might know her as your state representative, but she is also providing information awareness and resources to our community and understanding what you need to know about the changes that are taking place in Medicare. Robin, how are you?
I am doing good. How are you all today?
Yeah, look, I told you, I've been flowing like I flow. So before we get into the Medicare, Medicaid, all these things that we're going to be bringing for the next 3 months to our community, because October 15th is when the rush is coming on from providers calling you on your phone, commercials going on television, all those things. But I said, let's get somebody in here who knows. Number one, you help regulate some of these new laws that are being passed. Number two, you are a co-founder of InsureCare, the insurance providers. So before we get into the subject matter today, introduce yourself, a little bit of history about you so the people can trust you because our community.
Yeah, so I am Robin Shackelford, also your state legislator over on the east side and the far east side of Indianapolis. I serve as the ranking member on our public health committee at the State House. I also serve on the insurance committee and courts and criminal code. So that gives me a little bit of different insight that I have as far as policy and as far as the policy is made on Medicaid and Medicare. So I'm born and raised in Indianapolis. And the reason why I got into this business, into insurance, because I see my family members, especially my aunts, struggling with how to figure out Medicare. All of them are in that Medicare age, so I wanted to be able to help them and then also help my community. So I love my seniors. I love the senior community. If you guys have ever been, I do a biannual senior day at the State House where we invite all the seniors to come in. We pay for everything. They have a great day advocating on behalf of their needs. They get to talk with different state agencies. So now I'm partnering with HB so we can bring out some of that education knowledge actually to the radio waves and to you directly.
Man, thank you. And I just, so happy you kind of like leading me into the segue. RadioNext.tv. I'm not trying to be fancy. I am not trying to do anything but give information, awareness, and resources. And when you contacted me, I was so blessed and honored to know that you've been recognizing going into 15 years of what we've been trying to do to bring just simple information to our community about things that happen to us that we're just not aware of. And mainstream television, terrestrial radio, they don't have the time to do some of the things that we're doing. And so we have been blessed to say, let's come together and bring some lunch and learns. Let's bring together how the churches reach their community, word of mouth, and say, let's bring some information, awareness, and resources about Medicare. So you founded InsureCare. And because of your legislative duties, do the people even know what you do?
So that's why this year I'm really doing a full campaign to get out there and let people know that not only do I legislate, but then I'm also in the insurance space. So this year you will see mailers from me in regards to InsureCare. You will see we'll be putting Medicare 101s together. We have partnered with Centerwell. They have been a great partner. So weekly Medicare 101s at their facilities across the city. We're going to do meeting notices changes. Everybody's Medicare changes every year when it comes to Medicare Advantage. So on October the 13th and the 14th at Centerwell, we will be holding those 2026 Medicare update meetings. So I'm excited about going into this year's annual enrollment because now you know me as a legislator. I'm in your mailbox with my information as a legislator, but now you will also see that when it comes to insurance.
And I will say this, our partnership, we're going to turn this information awareness and resource up on steroids because we have already been in the background making sure that we're going to make in the next 2.5 months this information, available to where it's going to be user friendly. You're going to be fed not only to your stomach, but to your mind about some of the things that we're going to be giving you that you need to know. And I guess that's a great segue to starting this conversation about Medicare and what we're going to be doing each and every Wednesday at 12 o'clock p.m. on the Senior Scoop Internet Radio Show. Not only can you hear it on the Senior Scoop, I'll be replaying this information, Robin, on the Jumbo Love Show, the flagship of Radio Next. So, what we want to do is let's start the questions. And let's get basic. What's the difference between Medicare supplement, Medicare Advantage, and then in a two-part question, uh, who is the enrollment in period for between October 15th and December 7th?
So, great question. So, I get this all the time. I think I get a lot of seniors that are confused. If you are on a Medicare supplement plan, that is a plan that you're with an insurance company that you are paying a premium every month and is covering the gaps that Medicare A and B does not cover. So, it is covering your copays, your coinsurance, the deductibles. So, you basically have A and B, and then you have a supplemental plan that is covering those gaps. With that plan, you can go to any provider that accepts Medicare, but also with that plan, it does not come with dental, vision. It does not come with a prescription drug plan. All those plans have to be enrolled in separately. So that's something that has pros and cons to being a supplemental plan. Now, the other plan in which most people are on is an Advantage plan. With the Advantage plan, they're ran by insurance companies. You get your Part A, you get your Part B, but then Part C is the Advantage plan, and that's where you're getting the additional benefits like dental, like vision, hearing. You're getting those cards to use at the grocery store for over the counter. So it is combining A, B, and C, and then most likely it will combine D, your prescription drug plan. So it bundles everything together. Usually is no premium or zero premium, or the premium is very low for these. This annual enrollment is for the people that are on Advantage plans. It's not for people that are on supplemental plans. So we're just talking to the people that are currently on those Advantage plans going into annual enrollment.
I'm not laughing, but I'm smiling because you gave a lot of healthy information right there. But we have people, Robin, that are so, uh, I guess, ignorant. And I like to use that word. Ignorance is okay before you know.
Mhm.
And many people are ignorant even about Medicaid and Medicare.
Mhm.
And there have been many changes that have taken place between Medicaid, Medicare in the last few years. And I don't want to jump around in the way that we do this interview, but that's a good segue to explain the difference between what you've had versus what you are going to be expecting. 2026 Medicare changes that people need to know about.
Okay, so great question. So these are just some of those changes. Everybody know with Medicare Advantage, the plans change every year. You would have received a notice from your carrier, from your insurance company this week. So look in your mailbox, and it's called an ANOC. That means the annual notice of changes. And in that letter, they're going to break down to you what items have changed in your plan, what they may be covering, what they may not be covering, co-pays, co-insurances that may have went up, may have went down. And then you'll have to decide if you want to stay in that plan or if you want to comparison shop and look for a new plan. Some of those changes that have came down from the federal government, and this is going to affect all the carriers, is the federal government now If you are dually eligible, that means you're on Medicaid and you're on Medicare. You're on a D-SNP plan, and you get your flex card. And that flex card you get to use on groceries, on utilities, over the counter. Now they are going to start requiring that you have a specific illness in order to use that card for groceries and utilities. And I think I need to repeat this because this is very important. If your doctor does not sign off saying you have an illness that's on the list, you will no longer get to use your card for groceries and utilities. Your doctor
Let,
has to,
let me pause right there. Are they
yeah,
sending information about this to the general public?
yes. So
Okay.
everyone that's currently already on an Advantage plan, you're going to get a letter from your carrier and it will come this week. So I know a lot of you don't open up your mail. You have the mail stacked up, but look for something, whether if
Need to
you're
open that mail, people. Open
look
that mail.
Yeah, look for something coming from your insurance provider. So it's going to come from an Anthem, a Humana, a UAC, a Zing Health, Devoted. So look for a piece of mail that's going to be coming this week, and they're going to have those changes in there. Now that,
Now,
uh-huh.
okay, those are the peripheral changes. What about people with chronic illnesses like diabetes, heart failure, COPD, kidney failure? What should they expect in the changes that are taking place?
So because of a lot of the cutbacks that has taken place at the state level and the federal level, and because some of these major insurance companies have what they're doing is they don't want to take any more new clients. They have reached their maximum.
I don't mean to laugh, but damn,
Yeah, they feel like
as Florence would say it, damn, damn, damn.
so, yes. And what has happened is they have seen an increase in people that are 60 and over that's getting on Medicare. And usually those that are 60 and over are disabled. So they have been driving up the cost a little bit. So now you have your major insurance company saying, okay, we don't want to take any more people, any new people that's going to be on a chronic illness plan. Those are those C-SNP plans. If you got an insurance card and you have one of those chronic illnesses like diabetes, heart failure, kidney failure, or COPD, and you're on one of those plans, keep a lookout because your insurance company may not be taking any new people. Now, there are certain companies that's going to take new people and welcome new people. And then there are certain companies that's going to say, okay, we are going to only maintain our existing people and we're not taking anyone new. So, this is why it's important that you look over your information, that you meet with a broker, that you come to some of our meetings, because we will go over all those changes and let you know which companies are taking new clients, which ones are not. Also, there is a company out there, I won't mention their name, but they're going to be cutting back on if you can sign up for a PPO plan. Remember,
I'm
a
so
PPO,
happy. I'm so happy you mentioned that because I can talk candidly versus you being in the industry. And there are certain providers that the people need to know about that are being very, very sensitive to the different demographics, how they receive their message, than others who know that they have people who can pay and we don't have to serve the diversity of the information. And I can do that. So I don't want to go into the politics of that business, but I know that, and I'm trying to get my listeners to understand that. And so as we move on, I guess
yeah.
this would be a great segue to say, Miss State Representative and founder of InsureCare. You like that?
I like that. And just piggybacking on that, remember a lot of our members, especially in my district over on the east side and far east side, you are either in, you're dually eligible, so you're in a D-SNP, you're going to be affected, or you have a chronic illness. So a lot of people are in C-SNP plans because they have diabetes or they have kidney failure. So this is going to affect a lot of people in those marginalized neighborhoods, and they really need to understand this information and know the changes that's coming up.
See, I told you we're gonna be good at this. Because I can lead you in where you ain't even doing politics. You just giving the truth. But you know, I can talk about it the way I talk about it. So, how and when did the insurance companies inform us of these changes? Uh, I heard companies are scaling back on taking new members, and you already touched on this. How are they going to vet who they take in? How are they going to take in the districts where, much like what we were just talking about, that many people don't understand on how this is going down?
Yeah, so they're going to send out those letters in the mail, and it's going to be up to you to actually look over your letter. And then come October the 15th or prior, whenever you meet with your broker, you're going to have to decide if you want to stay in the same plan or if you want to shop around. I would advise everyone to shop around, not unless once you go over those changes and you say, okay, this is the plan, I'm good with the changes. But please expect that there's going to be changes in the plan that you're on. No plan has went untouched. As we're sitting with these carriers and they're
Say
going
that
over,
one more time.
no plan has went untouched. So as we're
So, what
sitting,
you've been used to, I just want to,
yeah,
I like to do this show like I do to my show. What you've been used to is not going to be happening anymore, is what Miss Shackelford is saying.
correct. And you cannot afford not to look at these changes. You cannot afford to wait until the last minute, to wait until December, and then finally decide to look. So I would advise you to go to a seminar, go to a Medicare 101, listen to the changes, and see where you need to be as soon as possible and get educated because
And
every plan has changed.
we're going to be giving you every week where the lunch and learns are, because Robin is going to be in several locations to where not only you can get information through this platform, but you can ask questions right there with her and her team at Insure Care. Robin, as we know, I was trying to give this information to the public because I am blessed to work with Sequoia Aging and In-Home Solutions and many other senior providers. I knew probably about 10 months before the Pathways Indiana initiative was coming in, and I saw what was getting ready to happen between the new way that they're bleeding Medicaid and Medicare together. And they gave you waivers that you could, like be introduced to this change. But we know that there's a big change coming that you didn't have versus when this was introduced. Please explain to our audience what they need to know.
So the first thing I want to touch on with Pathway for Aging is the waiver system. There is a wait list. That wait list, FSSA is continuing to work on it, but it has been, to least to say, not the best system that was implemented to make sure that our seniors were getting their assisted living facilities paid for, getting their hours paid for by the home assistants coming in. They have started to reduce hours drastically for your attendant care. So if you have someone coming in, a home health aide, those hours are being reduced because of the cuts that's coming down. So please be aware of that. There's not a lot we can do in the legislature. We have fought it throughout session, but you're going to start to see the effects of that as they start, because what was happening is they saw seniors were getting about 80 hours a week in attendant care, meaning they was having someone come in, help them with taking care of meals, help them with shopping, help them with their prescriptions, and they are scaling that back drastically. At most, you may get 40 hours a week, but no
So
longer
we're
will you.
talking about seniors who are dependent on respite care, seniors who are dependent on going to get their groceries because they are not able to, manufacture that function there. I'm telling you, And we went to lunch, and I told you, man, my life has been kind of cut down about 30% with the hip injury that I am dealing with now. I can only imagine if you can't do some of the things that you've been just used to doing, and they're taking away 50% of the ways that you've been used to living. That's what we're talking about.
That's what we're talking about. And so then when we start talking about getting ready for this Medicare, if you are on pathways and you're on Medicare, now is the year that they want you to be aligned. And that's what they're calling it, alignment. That means that your Medicaid company has to match your Medicare company. They've been kind of slow walking it, but this is the year that those two items must match. If yours do not match, and right now we're trying to figure out the exact mechanism that we're going to do this. What we heard is whatever you're on in Medicare, they're going to automatically put you on that same company for whatever you're on for Medicaid, they're going to automatically put you with that same company for Medicare.
And
So,
those two might not align with what you need.
well, that means your plan may definitely change. So I'll give an example. Say if you have Anthem for your Medicaid, but you have Humana for your Medicare. Now they're going to want to put you into an Anthem Medicare plan. And then you got to figure out what does that look like, what doctors will be, make sure your doctors are covered, make sure your scripts are covered. And that's when you're definitely going to need to have someone come and talk to you about it. So that is the biggest change when it comes for pathway to aging is now both of those companies must match. Before 2026, it was a maybe. They didn't have to match exactly. They gave you time to transition. Now they have to match.
And you know what, my candid way of explaining this before we close, do you want your right shoe from Adidas and your left shoe from Nike?
And now they got to be the same shoe.
So as we close today, I guess this is the good reason why we said let's get together to share this information, awareness, and resources to the community through this platform. Um, why is it so important to have a broker to help you navigate this confusing situation that seniors will be facing that they have never faced before?
So it's extremely important because, like you said, this information is so complicated. As brokers, this is our expertise. We have studied this information, we have met with the carriers, met with the government. So we know all the information that you need to know. In Assure Care, we do not charge. We are paid for by the insurance companies. We get commission. But as a broker, it's a difference between having an agent that's just with one carrier versus having a broker because we're licensed with pretty much all the carriers in Indiana. So we're going to be looking out for your best interests. We are
Hold
not
up.
catered.
Let me stop that right there. Every state is doing something different.
Mm.
And when you said in the state of Indiana, many people are calling you from national platforms that don't have a clue really about what is happening in Indiana. So I just had to bring that to the people because I told you I'm a conduit of information awareness and resources. You're an expert at what you do, and what someone might be calling you and telling you is best for you might not apply to the state of Indiana.
And you're absolutely correct. When you're on the phone and someone has called you from one of those companies, most likely they could be overseas, they could be another state. And so you want to have a local broker. I need to emphasize that. You want to have someone here in Indiana that understands our policies, our that's taking place, that understand our changes at that state level, and then also understands the Medicare system. So it's not going to cost you anything, but it really helps you and benefits you to have someone with this expertise and to sit down with someone. I know a lot of seniors just get frustrated. They throw their hands up. They take the first call that they get and sign up with someone, but please don't do that because those people do not have your best interest at heart. So even if it's not insure care, get with someone locally that understands the landscape and that's not tied to just one insurance carrier. You want them to be able to represent you among multiple carriers and give you all the options that's out there for you.
Now, as we close today, Robin, I tell husband and wives all the time, I want you to be united in everything you do except your health care Medicare plan once you become a senior, because that ain't got nothing to do with being tied at the hip. It has something to do with being attached to your needs and what you need in your Medicare supplement. How can they contact you? How are we going to continue together to bring this to the public and bring them out so they can ask you and your team at Insure Care some questions?
Yeah, so they can contact us easily over the phone. You can reach us at 317-759-3433. We are on social media. You can go to our website. Our website is insurecareinsurance.com. There you can sign up for an appointment by yourself or you can just give us a call. And we will be getting HB the flyers for those upcoming seminars. I will be holding office hours at Centerwell. Matter of fact, I'm going to be there later today at the one on Pendleton Pike at 2 o'clock. So feel free to drop in, come talk to me. I'll be there from 2 to 4 Pendleton Pike at Centerwell. So we'll get all that information out, those flyers for our upcoming seminars, the changes, and the Medicare 101s.
I told you, didn't I? We're going to do this thing between now and December 7th. Well, I told her December 31st. I know she has some things to do after that, but I'm going to continue to bring this information, awareness, and resources brought to you straight from someone who knows the game instead of me just talking about it. Robin, thank you. This is the kickoff to Insure Care Insurance Providers, RadioNext.tv, and the Senior Scoop Internet Radio Show. I love you, my sister.
Love you too. Thank you.
Absolutely. Hold on.